Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we will be in the book, which is called The Specialty Practice of Rehabilitation Nursing, a Core Curriculum, the 8th edition. And today we'll be taking a look at nurse theorists. So there are 16 nurse theorists that we want to take a look at, and we want to link them by their name, what they thought, and what they did. So the purpose of a nurse theory is to explain, describe, predict, as well as prescribe nursing care. Dr. Abdullah Faye had a philosophy, and she believed that nursing care was tailored to client problems. She also focused on physical, social, and emotional development, and she developed typologies of outcomes. She believed there were 21 nursing problems which helped transform nursing from a disease-centered to a patient-centered profession. Another nurse theorist, Virginia Henderson, also had a philosophy. She believed that there was a synopsis of a nursing definition to assist individuals sick or well for health or its recovery. Her focus was on nursing activities related to survival, which included air, food, sleep, clothing, hygiene, posture, play, work, worship, learn, communicate, and safety. She also felt that nurses should promote substitutive nursing care, doing for, supplementary, which is helping, and complementary, which is working with. Sister Elizabeth Kenny, who was a pioneer in nursing rehab, had a philosophy as well, and her philosophy included unique interventions based on independent nursing assessments. And her focus of nursing care was for people with polio. She also promoted principles of muscle rehabilitation at the Kenny Institute in Minneapolis. Ernestine Weinbach developed the conceptual model of nursing called the helping art of clinical nursing, which was influenced by Ida Orlando. And her philosophy was based on clinical nursing as a helping art. She also promoted maternal child nursing and applicable to family units and their rehabilitation needs. She also had 3 essential components associated with her nursing philosophy, and her components were around a reverence for life, respect for the dignity, worth, autonomy, and individuality of each human being, and the resolution to act on personally and professionally held beliefs. Florence Nightingale also had a philosophy, and Florence clinically focused on clean and quiet environments, ventilation, warmth, and sunlight. She also believed that nurses should promote the best conditions possible so nature can cure, and the use of one's own power. And you know, Florence is considered the founder of modern day nursing. Dorothea Orem, who was a nurse theorist, also had a grand theory, and her grand theory was related to self-care and self-directed care. And clinically, nursing is described as wholly and partially compensatory. It's supportive. It focuses on clients helping themselves, promotion of assistive devices and aids to obtain independence. Nursing theorist Hilgard Paplow had psychodynamic nursing, and in this she had a nurse-client relationship. And clinically, nursing makes use of the nurse here, and there are 4 phases of her relationship. It would be to orient, to identify, to exploit, and then there's a resolution. And nursing assumes the role of counselor here, leader, resource person, and teacher. Nurse theorist Ida Jean Orlando also had a nurse-client relationship, and she believed that clinically nurses are using the nursing process to meet the immediate needs of the client. So using the nursing process, they're going to explore the meanings behind client behaviors and determine the nature of distress unique to the client. She was internationally known for her psychiatric health, as a psychiatric health nurse, as a nurse theorist, as a nursing researcher, and she helped to develop something called the deliberative nursing process theory. And her theory really allows nurses to create effective nursing care plans that can also be easily adapted when and if any complication arises within the patient. Nurse theorist Lydia Hall had a model called the 3 C's. And the 3 C's what we believe she was doing with the 3 C's was utilizing care, core, and cure to treat her patients. And clinically, nurses are directing interventions to prevent fragmented care, as well as she established nurses as team leaders, which her model was initially used at the Loeb Rehabilitation Center in New York City. Dorothy Johnson had behavioral system model, and within her model, she had subsystems, house motivation, predisposition, choice, and action components. And in her nursing diagnosis and treatment is really aimed at classifying and determining problems to evaluate a balance. Nurses direct restoration and attainment of behavioral system balance and stability for clients. Nurse theorist Imogene King had an open system theory, and she looked at personal, interpersonal, and social systems. She's also known for goal attainment, as well as having a dynamic nurse-client dyad with mutual and purposeful goal setting. Madeline Langheimer is her model and theory are related to transcultural nursing. And this theory really provides cultural congruent nursing. Care is really at its essence, and caring is universal, and nurses assess transcultural variables through looking through the lens of one's culture. Myra Levine, a nurse theorist who had a conceptual model which included conservation, and she sought ways to teach nursing rather than theory development. And her principles are around energy, structural integrity, personal social integrity, environments, perceptual and operational, and conceptual. She also stressed conversation, redundancy, and therapeutic intention for promoting client integrity and holism. Betty Newman also had a model. Betty Newman's model, which we still use today, has to do with healthcare system model. And she looked at prevention as an intervention. She also looked at primary, secondary, and tertiary prevention practices. She helped clients to maximize their defenses. We also look at Martha Rogers, who had a nursing theory that related around 4-dimensional energy fields. She had pattern and organization of characteristics and behavior. And lastly, we look at nurse theorist Joyce Travelby, and her model looked at human-to-human relationships. She had a humanistic approach, and she believed that positive nurse-client relationship can bring favorable outcomes. So we looked at 16 nurse theories that were very diverse. Some have a lot of similarity. So you have to look at each theorist, what did they promote, and encourage or take what may be applicable for your own nursing practice and incorporate it to help your patients to get well. I thank you for taking the time to come back and follow along on our CRRN journey. I hope that you will share this information with a friend. And once again, now that we're in June, good luck on your examination. Take care and be well. Bye-bye.